I'm Katie, I'm 27, and I currently live in Boulder, Colorado. My story started when I was pretty young. I was in middle school when I started feeling not quite right.
Research shows more and more people are grappling with mental illness or substance use. A new report shows private insurance claims for depression and anxiety are growing, especially among young people. But getting affordable mental health treatment can be a challenging, uneven process that puts most of the burden on patients.
I didn't know what to do and let it go for a long time, which eventually escalated to drinking and then drug use. At that point, my parents started to notice I had been self-harming, so they saw cutting, and that's when they brought me to a therapist. My parents did what most people do, they get a directory or they look in the, ask insurance, and they just picked someone.
In 2008, a new federal law required insurers to provide mental health parity, or the same coverage for both mental health and physical health. It was expanded to apply to more insurers in 2010's Affordable Care Act, but there are still frequent violations, and parity varies from state to state. Some common kinds of violations include limiting the number or frequency of outpatient visits, restrictive prior authorization, or excessive reviewing of cases. And insurers may deny coverage for hospital care for substance abuse, claiming patients didn't try cheaper treatment options first. That's what happened to Katie, who by 18 had been diagnosed with severe alcohol use disorder, PTSD, and bipolar disorder. She had visited several therapists and even the hospital, but nothing was helping her mental illness. She says things got worse, and eventually a therapist recommended her family send her to a 3-month inpatient program in California.
My parents got the first month's bill, which was $33,000, and insurance said, actually, we're not going to pay. For 90 days of treatment cost $172,000, and the insurance provider paid $10,000. Despite saying that they would cover it in the beginning.
According to a 2019 report from the U.S. Government Accountability Office, roughly 1/3 of substance use patients and 1/2 of people with mental health conditions said they didn't obtain treatment because accessing it was so challenging. Parity advocates say that's just one part of the problem.
A second piece is that there are multiple layers of health insurance products from one company. One company can offer 20 to 30 different products on different tiers and offering different things. A third factor is how insurance companies define or decide how to pay for the services that they offer on the physical and on the mental health side. And there's things called medical necessity.
It's also hard to keep track of parity complaints and appeals, even with help. The nonprofit Kennedy Forum was started by Patrick J. Kennedy in 2013. It ranks states on their parity laws, transparency, and what conditions are and aren't required to be covered. And while it also tracks complaints from patients, that puts the burden on patients to self-report. And perhaps the biggest issue of all is accountability. Federal laws might be dense with legal language, but experts say they're still vague when it comes to enforcement.
The way health insurance is regulated and enforced in the United States is a very dizzying array of different state and federal agencies that are responsible for enforcement. For any given person, depending on what state you live in, there could be as many as 6 possible state or federal regulators responsible for enforcing your plan, and it's very hard for the average person, especially someone who's in mental health crisis or grappling with addiction, to figure out who it is that's responsible for enforcing their health plan.
All of this means getting treatment can be expensive. One 2017 report found patients in all but one state were more likely to go out of network for behavioral health care than they were for physical care.
All right, so these are all of my files for insurance. I print everything.
Katie is now on her own insurance plan, but she says she's finding her current provider to cover the therapist she sees twice a week. She pays $400 out of pocket to see them because there's no provider close to her that takes her insurance and specializes in her condition.
I, started the appeals process that they tell you can do, and it looks nice on paper. You have the right to appeal, just do this and this. There aren't forms, there isn't a layout, they don't tell you exactly what you need to send in. So I just created my own form and, kept track of all of the case numbers. It ended up being over a 6-month process of, they would send me no, and this is why. And then I would send them, another appeal. At one point, a thick packet, printed out every single therapist in network within, I think it was 50 miles. So I went through the whole list and cut out about half right away because, they sent me people who, only treat children, are for a traumatic brain injury. So I narrowed it down to who I could see, contacted all of them. Most were not taking new clients, had stopped taking insurance, had moved, and then of course, some people have passed away, but they remain on the list.
Newsy reached out to some of the big insurance providers, Anthem, United Healthcare, Blue Cross Blue Shield. We asked them how they decide which providers are in network or out of network and how they update their directories. Anthem said in part it's, quote, dedicated to continuing to add behavioral health providers, such as counselors, as well as psychiatrists, to ensure it provides broad access for its members. HCSC, Blue Cross Blue Shield's parent company, told us, quote, the provider directories are updated regularly based on information provided by the individual physician or the physician's group when they make changes to their practice/organizations, end quote.
Mm-hmm. What do you think of just looking at all this?
It's a lot, and I know it's too much to ask for most people because really in the end, most of this has got me nowhere. It's just denial after denial, but I wanted to prove to myself really that this is how big the problem is.